All right. Can you introduce yourself for the tape?
I'm Leah Litman, professor of law at the University of Michigan and author of the recent New York Times bestseller, Lawless: How the Supreme Court Runs on Conservative Grievance, Fringe Theories, and Bad Vibes, and co-host of Strict Scrutiny.
Which is an incredible read, by the way. And thank you for writing it. And of course, Strict Scrutiny, if folks aren't listening, it's one of those must listens if you want to understand the Supreme Court, both in terms of structure and in terms of vibes. So I really appreciate you making the time. And of course, we always ask folks to introduce yourself, but I feel like this is like an annual thing now, Leah. And given that we're both Ann Arborites here, I'm grateful to have you on again.
Glad to be here.
So, of course, it is Supreme Court season, which over the last several years has been a source of much consternation and sadness for all of us who believe in justice and the American way. And yet, here we are because we've got a number of cases up before the court that touch on a lot of the issues that are the substrate and of the conversations that we have on our podcast. Let's start with the one that's been ruled upon. And of course, we're taking this conversation on Wednesday, June 25th. So the court has yet to rule on some of the most important cases. But one of the ones that it has ruled on is the Scrimeti case, in which the Supreme Court ruled 6-3 to uphold a Tennessee law banning gender-affirming care for minors. We know that the conservative majority was leaning this way. If you listen to any of the arguments ahead, but this is one that also has pretty devastating consequences. Can you give us a sense of what kind of precedent this might set, and how this might architect toward different kinds of decisions or cases that we might see before the court?
Yes. So I think the bottom line is this really legitimizes forms of sex discrimination and gender identity discrimination by insisting it's not actually sex discrimination or gender identity discrimination. And so the concern is this really opens up avenues for states to restrict medical care that does discriminate and disproportionately burden women, and that does discriminate and disproportionately burden the trans community. So the Tennessee law at issue in this case actually references sex 19 times. It says the entire purpose of the law is to make people appreciate their sex and to restrict medical care that is inconsistent with an individual's, biological sex is the term that they use. And the Supreme Court insisted that the law did not discriminate on the basis of sex. And it suggested one reason why it didn't is because it was in the field of medicine and it concerned a medical procedure. But the fact that the law regulates medicine, of course, does not mean it doesn't discriminate on the basis of sex. And the concern is that the Supreme Court is basically saying, well, in the medical field, if a state can point to some plausible distinction rooted in biology, well, maybe the Supreme Court is now going to allow some amount of sex discrimination in that area. I think in some ways the court's rationale as to why it didn't discriminate on the basis of gender identity is even more outlandish. So there, the Supreme Court said, well, sure, the group that is negatively affected by this law is just trans minors who can no longer get hormones and puberty blockers for treatment for gender dysphoria. But we're still going to say the law doesn't discriminate on the basis of gender identity because both cis and trans kids can still access hormones and puberty blockers for other reasons, like congenital defects. But that rationale is just super weird, as Justice Sotomayor indicated in her dissent. So again, the concern is the Supreme Court basically pretended discrimination wasn't actually discrimination and thereby potentially invited more of it.
And it's, one of the key points here is just a lot of these medications are available, right? And it's not like the court wants to go after the medications themselves. So the only reason why you wouldn't be able to access these medications is foundational to gender identity. And yet the court is arguing that this is not actually the basis for discrimination. And so it's like a paradox of legal reasoning that it's like refers back on itself over and over and over again into oblivion. It's like the death of one of these stars as it just like compacts into its own gravity.
Yeah, no, like the Death Star, or it's turtles
Yes.
all the way down, right? Because as you're saying, these hormones and puberty blockers, they're not prohibited. You can still access the exact same medication just to treat other things. And I think that underscores these aren't dangerous medications. And it also reveals the only thing the state is targeting is treatment for gender dysphoria, which, as you say, is inextricably linked with gender identity and what it means to be transgender.
Yeah. It's, in part of the context I want folks to understand here is, there is a broader set of norms around liberty that is being attacked here. And then, we're just a couple of days from 3 years away from the disastrous decision in Dobbs, that puts people in robes or people elected to legislatures in positions to decide when and how you can get care. And it's essentially anti-conservative, right? In the sense that conservative ideology is based on the notion that you should be able to make a decision at the lowest possible point of decision making, meaning you should be able to have access to the things that your doctor thinks you should have. But this is about one size fits all policy around very specific circumstances in which you cannot access a medication. And anybody who believes in like basic liberties should be very worried about the implications that this sets up.
Yes. And so you mentioned Dobbs, and actually the decision in Skermeti relies on the same archaic sex discrimination case that Dobbs revived, this old 1970s case, Geduldig, that said when legislatures discriminate on the basis of pregnancy, when they discriminate against pregnant people, that isn't sex discrimination. So that's the line of thinking that the Republican justices are reviving. And it's really like a Maha, make America healthy again vibe, throughout this entire opinion, as well as the concurrences where you had Clarence Thomas mocking the self-proclaimed experts on gender dysphoria and gender identity before he launches into his own treatise and his own views about gender identity and gender dysphoria, as if he knows better than the doctors.
Yeah, it's it's fascinating, right? Because ostensibly the only reason you get to serve on the Supreme Court is because you are an expert in the law. And then to see somebody who is an ostensible expert in the law mock other forms of expertise and then wax philosophical about the things on which they are not expert. Again, it's like one of these sort of enigmas wrapped in a paradox.
Right.
So one of the other cases that's really important from the health standpoint is yet another challenge, who saw it coming, to the Affordable Care Act. And one of the things that the Affordable Care Act does is that it requires health insurers to cover preventive care at no cost, things like mammograms and colonoscopies. And what it does is it appoints a task force of about 16 people who decide which services are supposed to be covered. And then the case goes after the fact that because these 16 people are appointed by the HHS secretary and not confirmed by the Senate, that somehow this is unconstitutional, which is, of course, just based on principle, because let's be clear, those preventive services benefit both the insurers and the individuals receiving those services. So what would it mean if, in fact, this was found to be unconstitutional? What would it mean for access to preventive care? What would it mean for the Affordable Care Act writ large?
So when you say it's based on principle, this is a case brought by an employer who objected to having to provide health insurance coverage for both PrEP, pre-exposure prophylaxis drugs, as well as contraception, on the ground that this facilitated, choices, lifestyles with which the employer disagreed. So that's who's bringing this case. And it really would, I think, completely disarm and render totally useless the Preventative Services Task Force, because if these members of the task force were not constitutionally appointed, then that would mean all of their designations of which kinds of healthcare insurers have to cover are void. So they can't require insurers to cover any kinds of care unless and until the Senate confirms members of the Preventative Services Task Force, given how the Senate is operating, in part because the Senate confirmed RFK Jr. to be Secretary of Health and Human Services. That doesn't bode particularly well for the future of the Preventative Services Task Force.
Yeah, that is a really dire thing to think through. And also, it's just so completely self-defeating. You'd imagine under a different administration, you could just have the HHS secretary, who is Senate confirmed, directly make the recommendations, and that way you would bypass this entire situation. But given where we are in this administration, it is a well-timed attack that is intent on trying to dismantle as much of the ACA as possible. And just again, let's just think through this. These are services that benefit the people who receive them and the people who provide them. Because of course, if you can prevent a case of HIV, you don't have to treat a case of HIV. If you can prevent a pregnancy that's unwanted, you don't have to pay for pregnancy services and delivery. All of this is just about trying to attack on principle. And it is just so deeply frustrating to watch our government attack itself and the things that it's actually gotten right that benefit people out in the community.
It's also entirely like cockamamie theory, because the idea that the members of the Preventive Services Task Force are officers that have to be appointed, these are part-time volunteer individuals who have full-time jobs elsewhere. These are not officers of the United States on the same level as the Secretary of Defense, who has to be presidentially nominated and Senate confirmed. It's just silly.
That is wild. And, again, it's like you have to give them credit for trying to find the thinnest possible read of an argument,
Yeah.
and then trying to overblow it as much as possible. And I do hope that folks who want government to actually do good things for people are taking notes, right? Because too often, I think, approaches to a more broad-shouldered, muscular government intervention to provide people basic things like healthcare, we argue with ourselves before we actually try to make the argument, and then we become self-defeating in our own ways. And so I do hope that a lot of us are taking notes here, because if they're willing to try and take out the ACA and access to preventive services like this, then I just think that there's a lot of space here to be saying, well, look, like if you want to stretch public policy in this way, like let's just make sure we're leveraging what's available to make the best possible case to provide people good things in their lives.